Hello everyone, welcome to QXon. In this video, we will discuss how resting membrane potential is generated and how it is measured. So basically, cells have a potential across their membrane which is defined as difference of electrical potential or voltage across the cell membrane of an unexcited cell, that is a resting cell, that is called as resting membrane potential, and it is present across the cell membrane of almost all cells. However, it is most important for excitable tissues or cells, that is nerve, muscle, glands, because these excitable tissues actually respond to a stimulus. So like in nerve, when there is a stimulus, there will be change in the voltage across the cell membrane, that is known as action potential. So the voltage which is present in resting state on an unexcited cell is called as resting membrane potential. So how can we record this resting membrane potential? So for recording any potential, we need two electrodes, isn't it? And similarly, for recording this resting membrane potential, we will need two electrodes. So one electrode is dipped within the cell membrane and it goes in the cytoplasm, and the other electrode, the indifferent electrode, is kept outside. So this will measure the potential inside the membrane with respect to outside the membrane. And these electrodes are then connected to voltmeter, which can detect very minute voltage differences across the membrane. So what we see is that the neuron resting membrane potential is approximately minus 70 millivolt, but yeah, it will vary for different neurons. But for understanding, we are taking one value right now. So neuron resting membrane potential is minus 70 millivolt. Then skeletal muscle, it is minus 90 millimoles, and there is a cardiac muscle whose resting membrane potential actually changes. So it is from minus 55 to minus 90 millimoles. So how is that cells develop a resting membrane potential across their membrane? Well, there are two things. One is a difference in relative distribution of ions across the membrane. That means the number of ions which are present inside the membrane is different from the number of ions which are present outside the membrane. Also, the type of ions which are present inside the membrane differs from that present outside the membrane. And this is brought about by difference in permeability of the membrane to different ions, what is known as selective permeability of the membrane to different ions. So this is explained by Gibbs-Donan equilibrium. So it considers these two factors and explains that how resting membrane potential is generated. So to understand Gibbs-Donan equilibrium, let's consider some ions which are present inside the membrane. So here this is the cytoplasmic side, and the ions which are present outside the membrane. So here suppose potassium, the positive ions, are present outside along with chloride ions, and the positivity is neutralized by the negativity of the chloride ions. Similarly, inside the membrane there are potassium ions, and there are proteins, negatively charged proteins, which are present inside the membrane, and again the positivity of the potassium ions is neutralized by the negativity of the proteins. So basically both the solutions outside the membrane and inside the membrane are in electroneutral condition. The positive charges are neutralized by the negative charges. Now this membrane is permeable to what? Well, for understanding, we'll consider that the membrane is not permeable to chloride ions, and the negatively charged proteins which are present, they also cannot cross the membrane. See, why we are considering proteins inside the membrane is because the cell synthesizes the proteins and they remain inside the cell. Plus, the cell membrane is impermeable to these negatively charged proteins. Fine. Now, on the membrane, there is the presence of leaky channels for potassium ions. So, that means the membrane is permeable only to potassium ions. Plus, you see, the situation which we considered in the beginning, there were more potassium ions inside the cell rather than outside. So there exists a concentration gradient for the potassium ion from inside to outside, right? So the two things here: one, membrane is permeable in resting state only to potassium ions because of the presence of the leaky channels, and there exists a concentration gradient for the potassium ions from inside to outside. So if there is a concentration gradient, and obviously they can move from inside to outside because of the presence of leaky channels, so the ions will move from inside to outside, isn't it? And because of this, the number of positive ions outside will increase. See, initially we said that the positivity is neutralized by the negativity, but because of the movement of the potassium ions along its concentration gradient from inside to outside, now the positive charges will increase on the outside. So you see, the positivity has started developing on the outside, and with respect to outside, the inside is becoming negative because the positive charges are moving out, obviously. So here negativity is accumulating. Fine. Now when we consider the ions which have a charge, we have to look to the concentration gradient as well as one other thing, the electrical gradient. So there are two forces which can drive the movement of the ions. One is concentration gradient and one is the electrical gradient. In the beginning we said that the positivity is neutralized by the negativity, so actually there was no electrical gradient, but because of the concentration difference of the ions, there was only concentration gradient. But as these positive potassium ions start moving outside and the positivity develops on the outside, what happens? There starts developing an electrical gradient. Now, the direction of this electrical gradient shown here will be from outside to inside because the positivity is developing outside. So, the positivity will repel the positive ions, isn't it? So, these potassium ions now are having another force which is causing them to move from outside to inside. So, concentration gradient causing them to move from inside to outside, while electrical gradient is causing them to move from outside to inside. So, with the tendency of potassium ions to move from inside to outside along its concentration gradient and outside to inside along its electrical gradient, what happens? There develops a point when these forces become equal and opposite. So, when the forces become equal and opposite, there will be no net movement of the potassium ions, and the diffusion will stop when concentration gradient becomes equal to electrical gradient. At this point, a potential difference is developed across the membrane with positivity outside and negativity outside. And this is the potential which we are calling as resting membrane potential.